Dr. Seo,
Yeah.
can you please introduce yourself to our patients again?
Hi, I'm Seo, a plastic surgery specialist at Soonplus Plastic Surgery.
Alright. Dr. Seo will be talking quickly about the jaw reduction surgery. So, what is exactly a jaw reduction surgery?
To explain jaw reduction surgery, first let's discuss the lower jawbone. We call this the mandible or jawbone. What we're looking at is the angled part under the ear called the mandibular angle. If this area is larger and the length is long and the width of the front mask is wide, the surgery to reduce it is called jaw reduction surgery.
So, usually, to what kind of patients you recommend this surgery?
In Korea, when the mandible is naturally large or has grown larger, there are a lot of people who feel it gives too strong of an impression. And since those kinds of people would prefer a smaller face, people with large mandibles would opt to have a smaller face or a softer look. And this is where this procedure comes in.
So, how is the jaw reduction surgery performed? Is it a dangerous surgery?
First off, cutting off bones isn't always good. So a CT scan or an X-ray is taken before the surgery in order to observe the shape of the bone and to measure the nerves that pass through it. Since it's invisible from the outside, nerve damage can occur if you cut a lot of bone unconditionally. So, after looking at the CT scan, the patient's consultation results, and determining how much to reduce, we proceed with the surgery. The operation is performed under general anesthesia. We make incisions on the inside of the mouth and gums, expose the bones, and the patient lays like this. We operate on this side, the top. Then we expose the bones through the lower gums. Then we cut the bone right here with a medical saw. And after all of that, we sew it up, and then the surgery is finished. After the surgery, we proceed with taping. We'll tape the lower part of the jaw right here for 3 to 5 days, and bandage wraps will be used for a day or two. In my case, I don't use a surgical drain, just so that my patients will feel more comfortable.
I see. So, what are the results or the advantages of this surgery for patients?
First of all, the biggest advantage of this is the change in impressions. As I said before, big mandibles mean stronger features, and one's face ends up looking bigger. Through this surgery, we can reduce the size of the face, giving it a soft and classy facial expression.
After this kind of surgery, what is it and how long does it take?
Once you have the surgery, you're going to be bandaged for a day, and taping the surgical site is required for 3 to 5 days. After the tape is removed, nothing is seen on the outside. There's no visible wound since the operation was performed inside of the gums. But there will be a little swelling, and that swelling goes on for about 3 days and then goes away. Some processes can help for a speedy recovery, namely wearing a bandage on one's face, putting on cold compression, or, depending on the timing, warm compression. And after a set amount of 10 days, the stitches in the mouth are then removed.
So, people afraid of this surgery, can you give any advices to these people who are scared of having this kind of reduction surgery?
Usually, patients think it's a big surgery to have one's bones reduced. Hence, there's a lot of worry surrounding it. General anesthesia is needed since it's a surgery in which bones are being adjusted, and that leads to people worrying, thinking it's a dangerous procedure. But general anesthesia is there for safety, and the anesthesiologist is always there, monitoring the patient's condition, so it is safer than one thinks. And for the operation itself is a big one, but the concern regarding the nerves and the blood vessels passing through the bones and being possibly damaged, the X-ray and CT scans are there to ensure that such concerns are checked and put to rest right before the operation. We check whether the blood vessels and nerves are in danger before going into the procedure, so that it wouldn't be much of a concern during or after the surgery. Pain shouldn't be too much of a concern either. A person's sensory nerves aren't developed within the bones, so there is pain, but it's not the kind of pain that's similar to something like one's skin or flesh being ripped or, say, injured by a sharp object. Instead, you can compare this kind of pain with things such as bruising of the flesh or maybe spraining a muscle. When examinations were done thoroughly before the operation and the procedure itself is kept safe and adhering to the standards, it really is a surgery that is just as safe as other procedures.
Great. So last question, what are some side effects for this surgery?
Repeatedly, I've said to remember that nerves, blood vessels, and muscles pass through the bone, so it really needs to be checked. And if one reduces too much bone, the proportions of the face become unbalanced, and it would be difficult to get back to the original state. So in order to get the operation right for your face, the proportions and reductions need to be decided well before the operation. And this kind of surgery doesn't need any implants or such. It's simply a procedure that reduces the jawbone, so the dangers of infection are much less. To conclude, don't excessively reduce the jawbone, check the relations of the nerves and blood vessels, and have the right plans before and during the operation, and there won't be any adverse side effects or problems.
Great, everything is clear. Thank you, Dr. Seo.
감사합니다.
This was plastic surgeon specialist Seo from Sun Plastic Surgery. Thank you.